So, welcome back, everybody. I hope you all enjoyed getting to know Grace and her family as much as I did. I think this is the third or fourth time I've watched this beautiful film, and every time I watch it, I get something different from it. I'm constantly reminded, first of all, what an amazing family Pamela has been born into, what a wonderful mother and father, and how much their hopes and dreams are just like the hopes and dreams, I'm sure, of everyone watching this panel today. And then that really chilling moment struck me today when, after Grace has given birth, her mother says to her, "Thank God you have survived." Can you imagine living in a context where your family sort of have to rejoice in your survival after you've given birth to a new baby? But an absolutely beautiful film. Thank you, Austin, so much for bringing that to us. So I want to introduce today's panelists. So joining Austin, we also have Gift Malunga. And Gift is UNFPA's country representative in Zambia, and she has over 20 years of experience in strategic management and policy and program development in sexual and reproductive health. Gift has also worked in UNFPA's offices in Kenya and Zimbabwe. So huge welcome to you, Gift. Thank you for being with us. It's wonderful to be joined by two incredible advocates for women's health. So before we begin the panel, though, and we get into our conversation, which I know is going to be really interesting, I just want to invite all of our attendees to submit questions for our panelists. We're going to try and do this live into the Q&A function at the bottom of your screen. So if you look at your screen, on the right-hand side, there should be a button that says Q&A. If you click on that box, a pop-up will appear and you can put in any question that you would like to ask someone on the panel. And we will try and get to those as much as we can. But first of all, I just want to turn to Austin, having just watched this wonderful film. And Austin, I just invite you to share with us how this film with Grace came to be. What on earth led someone like you, living in California, to decide you wanted to document maternal health in Zambia? Explain to us about how you ended up spending this time with Grace and her family.
It goes back to 2015. I had recently finished graduate school of journalism at Stanford University and was selected by one of my journalism idols named Nicholas Kristof, who's a columnist at the New York Times, to travel and report with him internationally, covering human rights and global health issues. One of the places that we went to report was India. And while we were there, we were reporting on maternal health and malnutrition. I was traveling with Nicholas Kristof, who, again, was one of my journalism idols. We were also traveling with the head of nutrition for the Gates Foundation. And we were going around to all these various locations, talking to mothers, talking to families about their experiences with childbirth, about the support they've got or lack of support and lack of resources they've got. And in that context, talking with Nick, talking with these families, talking with nutrition experts, I became fascinated by this time period of life referred to as the first 1,000 days. So the first 1,000 days represents from the time a child is conceived to their second birthday. It's about 1,000 days. And it really is the time in life where, if health interventions are made there when a child is in the womb, when a mother is getting ready to deliver, that investment, I mean, the lifetime potential of that human being is so much greater than if we're investing down the line. It's like that investment up front. And I became so fascinated by how these small decisions and those small investments at that time in life could really uplift an individual, a community, and then you keep broadening that out to the world. But every time I kept hearing these stories, they were just told in these abstract statistics like maternal mortality rates, infant mortality rates, malnutrition rates. But what I was seeing in front of me was so visual: the love between a mother and their child, a family coming together, a community rallying to help, when that lack of resources exists, to help have a successful delivery. So as a filmmaker myself, I decided to set off and try to bring visuals, try to bring those individual stories to life. And that is what led me to being inspired to dedicate a few years of my life to creating this film.
Amazing, and we're really, really glad that you did, Austin. I just want to bring in Gift. Gift, thank you so much for being with us today. It's a great pleasure and honour, and I know you're incredibly busy with the important work that you do. So thank you so much for making the time to be with us. Um, so I'd like to just start with a couple of questions to you, Gift, about the situation in your region. So in the documentary, we learned shockingly that there's only one ambulance in that region servicing 39 health facilities and a population of over 200,000 people. So, given that context, how does seeing a film like With Grace make you feel? And tell us a little bit about how your office works to improve maternal health outcomes for women like Grace.
Oh, thank you, Amanda. There are so many women and girls in rural Zambia like Grace, and that is why UNFPA and partners are working to reach those furthest behind. Our aim is to ensure that every pregnancy is wanted and every delivery is safe. So we are procuring family planning commodities, more than 60% of the public sector needs. We are training healthcare providers as well as community-based distributors in a variety of methods. And the community-based distributors have been our greatest ambassadors. But for pregnant women, we're engaging communities, working with the traditional leaders and even families to encourage women to attend antenatal care, because when there's a complication, it can easily be diagnosed. We are also encouraging women to go and wait at health facilities where they are waiting mothers' children because of the long distances. And this is why evidence in Zambia has shown that 84% of the maternal deaths are occurring in health care facilities. And it is because the women are arriving late. In addition, it points to quality of care. And that is why UNFPA is working with the donors like the UK government through FCDO to buy equipment, life-saving equipment, like the resuscitators that you heard about, like the suction machines, the anesthetic machines, to buy essential drugs that assist in helping complications. We are also training nurses and midwives in emergency obstetric care. This is a skill where a midwife can quickly diagnose a complication, stabilize the mother, and refer to the next level. But now the challenge is, as we have heard from this documentary, is about ambulances. So the referral system is another challenge. UNFPA has bought vehicles. They are not ambulances, but vehicles that are currently being used as ambulances to pick mothers. You can imagine where a mother is referred from a rural health facility when they're bleeding for 5 hours. You can already tell the outcome. That's why every day we are losing more than 15 women. And by the end of the year, we would have lost about 800 women. This is unacceptable. Every life matters. This is what we are doing here. Yeah, this is what we are doing in Zambia.
Thank you, Gift. And just your comment on the wonderful film that we've just watched. Does Grace's story feel familiar to you? Do you think it depicts the experience of a lot of the women in Zambia that you're working with?
There are even worse situations. At least Grace now, after delivering at home, then realizing that for this fourth delivery, she had to deliver in a health facility. Others, they struggle when they reach the health facility, like calling for an ambulance. There's no network, there's no transport, and it takes so long for the main ambulance coming from a district hospital to come and pick them. It could be the woman has high blood pressure is one of the major complications. It could be the woman is bleeding as one of the major complications that we are seeing here. It could be due to obstructed labor. So the health center cannot deal with such complications. The woman has to be transferred to a facility where cesarean section can be done or blood transfusion can be performed.
Yeah.
That's why women are dying here in Zambia.
And I just wanted to add real quick on what Gift
Yes,
said right there about Grace making that decision to go deliver at a health facility. That was one of the reasons that her story really stood out to me, and when I was deciding on who I was going to follow for this documentary, because not only do I want audiences to see this film who may have the resources to donate to the work that UNFPA does, but I'd also love for people in Zambia to see this, and people who, maybe themselves are a little nervous about delivering at a health clinic. So to see an example of someone who, had that experience of delivering at home and is now choosing something else, choosing another decision, I think that could be a nice little educational component to bring awareness to the benefits of delivering at a health clinic.
Fantastic. I mean, I think, I won't speak for our audience, but I think one of the things that will have surprised maybe some of our audience is how very simple the facilities are in the clinic that Grace goes to. Because in the West, of course, people are used to the idea that when you go into a health facility to give birth, you're surrounded by equipment. But I think one of the things I've learned at UNFPA is actually the most important equipment is very simple and not expensive, and the most important thing is to be around trained personnel rather than lots of other sophisticated and more expensive equipment. I noticed that one of our audience, and I'll ask Margaret's question now, Margaret Snowden asked the very good question, is do these facilities have electricity, and can they count on an electricity supply? Do you know the answer to that, Gift?
Some do have, but most of the facilities in rural areas, they don't have electricity.
Yeah.
So they depend on lamps or even maybe solar light if it is available. So you can imagine if there's a tear, like a cervical tear, will you be able to see where the tear is? You just see blood, a woman bleeding to death.
Yeah.
Yes.
Yeah. Yeah. But even so, I think the message we're sending, and Austin, you emphasize this, is even so, it's still safer and preferable for a woman like Grace to go into one of these very simple clinics where there's a trained midwife on hand and there'll be, sterilized equipment, etc., etc. It's still a huge lifesaver to have these clinics available and have trained midwives working in them. So, Austin, I think we've got questions from people who are fascinated to know how you actually met Grace. So tell us a little bit about the story of how you met Grace, and how did you persuade somebody like Grace? You're probably quite a strange character to appear in her life.
Yes.
With your camera and your American accent. So how did you build that connection with Grace? And also I'd love to hear about, since you made the film, have you heard from Grace, and has she watched the film? I'm sure some people would like to know that.
Yeah. So the process of developing a connection with Grace and even meeting her started way before I even arrived in Zambia. I cold emailed, cold LinkedIn messaged anyone I could find who worked for health organizations in Zambia, who were maternal and child health specialists. And you saw a bunch of credits at the end of the movie, which were people from different organizations who offered to give me some support when I got there on the ground. One of the main organizations was called the Center for Infectious Disease Research in Zambia. And they allowed me to work with their kind of network of nurses that would go into different communities around the country and advise women, advise healthcare professionals. And so I talked with those nurses a lot early in the process of what are the types of issues that we want to cover in this movie? What is representative of the whole? What is not being talked about enough? And that's when we decided to focus on a rural area, and try to focus on someone who delivered when they were a teenager, who didn't finish high school, some of these high risk scenarios. And so we targeted this one village called Katoba in Chongwe district. And so when I first went out there, I was going with the nurses who that community would be familiar with. We went on a day where women were there for prenatal care. And each of them had these little booklets, and in those booklets had their vital health information as well as their due dates. All of them were pregnant, of course. And based on my timeline in Zambia, I knew I needed to try to find someone who's going to deliver in April. So we found everyone in the clinic who had a due date in April. We brought them to another room. And then through the translator, the nurse that I was with, we talked about who I was, what I was doing, what my goals were with this film, and also what it would mean to want to be a part of this. Like, I was going to be around a lot. And so once we gave that little talk, we said, if anyone's interested in chatting one-on-one, like, stick around. If not, that's totally fine. And Grace was one of the women who stuck around to chat with us. So I interviewed her one-on-one, and all of this was happening. No cameras, nothing like that. In the first couple of visits, no cameras. I was just there to develop a connection with her and make sure that she felt like, one, that she could say, I don't want to be a part of this, and that's totally fine. And that she knew what she was signing up for. And outside of, what I mentioned before, which is like, she represented this change that I found was really interesting. She also represented the demographics that I was interested in documenting. Her husband spoke English, which, as someone who was there filming completely alone, doing all the audio, all the video, directing, having someone with some English capabilities, I knew was going to be really helpful for me. And then also Grace's personality really just came to life on screen. Like, she had a big voice. She had a lovely smile and laugh. And unlike when you're writing a news article, where sometimes that doesn't matter as much, when you are making a documentary film, you really need that personality to kind of come off the screen and come to life. And so that's why I chose Grace. And thankfully she was open to letting me into her life. Now, to your second question about have I connected with them? Yes, I did. And I recently, this past weekend, actually sent a videographer and my translator out to Chongwei District to revisit the family. They downloaded the movie that you all just watched onto a laptop, brought it to them, and they saw the movie for the first time. And then we also did little interviews with them about their lives now, which will be incorporated into the credits of the movie coming out on Friday on YouTube, which will be public and available for everybody. And Pamela is now 3 years old. She's in primary school. I have a clip of her singing her ABCs. And I was surprised to find out when I got the footage back that they have another baby. They have another baby named Peter, a young boy. So Pamela now has a little brother as well.
I am not surprised, because at the end, he says he doesn't want any more children, and she says that she does. I was absolutely confident that Grace would win.
Yeah. That's what he says in the footage too. He's like, she wanted one, so I'm in.
That's wonderful. And do you know if the more recent baby was born in a clinic?
I believe so, but I didn't get a chance to talk to them about it. So I mean, that's an interesting question. I should follow up on that.
And I guess just one other follow-up question. Do you think Grace had a sense of any message that she wanted to convey? Because it's quite a big thing for a young woman to agree to have their pregnancy tracked by a filmmaker. I wonder if she did she understand that this goal of communicating a health message, and is that something you felt she was behind?
I hope so. I think I experience this in so many of the stories I tell. Sometimes I don't know exactly why people agree to kind of let me into their lives. I think part of it is when I go to someone and say, like, I want to tell your story, there's a lot of power in that. And there's a lot of power in someone feeling listened to, someone feeling heard, someone feeling like their experience is of vital importance to not only like their immediate community, but also in this sense, like what I was saying was the world. Yes. I told her early on that when it came to like my journalism ethics, I wasn't able to like pay her financially to be a part of the movie. Like I couldn't pay her to be a part of it. But I did explain very early on, I said, like, the goal with this project is to show the scenario that so many women around the world are facing. So many of the women who are facing challenges, and you sharing your story, my hope, will be able to generate support for the millions of women like you. Whether that is the message that resonated with her and why she said yes, or whether she thought it was just like a unique kind of crazy experience to let me into their lives, I don't really know. It could be all of the above. Yeah. But I'm very grateful she did, and I hope she had I hope she reflects on it fondly.
Well, I mean, as you said, she certainly is making her mark on the world through that amazing film, and I'm sure that film will carry on resonating and having an impact. Gift, I'm just going to turn to you again. I'm sorry, there's a noise outside my house, but like that. Of course, in addition to all these challenges with maternal health care that we're facing on a day-by-day basis, we've been dealing with a COVID-19 pandemic, Gift. So I wonder if you could talk a little bit about the additional challenges that the pandemic have created in delivering safe maternal health care in a country like Zambia, and what UNFPA has been able to do about that.
The COVID-19 pandemic, I think it challenged everyone, including the pregnant mothers. It sort of threatened to unwind or to undo all those gains that we had achieved over the years. We witnessed during that period, especially during the third wave, that there was a decline in utilization of maternal health care services. So we really had to up our game to ensure that these essential maternal health services continue. So we engaged even communities to encourage women to continue to come through for antenatal care, although they were scared that they would catch the virus there. We even worked outside the box to ensure that we electrify one of the COVID centers. You know, electrifying a health facility is not really the norm for UNFPA, but we had to do it because we realized that even our mothers would catch COVID and they would go to the health facility, so they would need, you know, to be assisted. They would need oxygen, and it required electricity. We brought in retired midwives with the support of the UK government through FCDO to enhance the human resources for health, as their attention had been diverted towards COVID. So we didn't want our mothers, you know, to have limited care. So that's why we brought in the retired midwives. We procured personal protective equipment, including infection prevention control and supplies. We procured even dignity kits for women to sustain their dignity. We even went as far as supporting the Ministry of Health to develop guidelines, clinical guidance for responding to COVID-19. So slowly, we saw now an increase in women now coming back to deliver in health facilities. But because of the restrictive movements during the third wave, you know, that's why we saw a decline. But that's when we also enhanced our intervention, working through our partners to reach those communities so that the women will be delivered in health facilities.
That's fantastic. And I think it's this, I mean, we can't say thank you enough to you and your UNFPA colleagues for the amazing work that you do. But I think, you know, there's an additional thank you, as we know so many health workers around the world have continued their service despite really difficult conditions. And for me, watching UNFPA staff, midwives and colleagues in the field carry on doing the remarkable work they're doing despite the enhanced risks created by the pandemic has just been awe-inspiring. So I'm sure everyone will join me in saying what a huge appreciation we have for that. And I recall at the beginning of the pandemic, you know, the conversations about what's this going to mean for our programming, and are we going to have to put some of our programming on hold, and the answer from UNFPA staff was absolutely not. Women continue to need us, and women are going to continue having babies, and we need to make sure we carry on delivering the services. So it's incredibly impressive. I just want to touch on something else, Gift, if you don't mind, because famously UNFPA also distributes emergency birth kits. I know this because it's one of the things that our donors most like helping to pay for. And I think people often ask me about this. It's such a simple kit. It's not expensive, but I know, you know, that the kit with the clean plastic sheeting and the razor blade and other items really, truly can be life-saving. So if there's any donors watching who've ever questioned that, it truly can help to save the lives of mothers and babies. Tell me why we're putting so much emphasis on the importance of women getting to clinics if they can, why we still place so much emphasis on these birth kits?
I think to answer the first part of the question, it's very important that women get to health facilities and be delivered by a skilled attendant. It's not just good enough to be in a health facility, but a skilled attendant, because a skilled attendant is able to diagnose a complication and stabilize the mother and maybe refer. Especially, I'm looking at the rural health facilities, which is the first level of care. But if the woman does not or is not attended by a skilled attendant, then she is in problems, because the non-skilled healthcare attendant will not be able to diagnose a complication, because it is complications that kill women and not just normal delivery. So the birth kit that you are referring to, when we distribute those to rural health centers, they are life-saving. If you listened in the documentary, there was a nurse who was saying you need to bring a razor blade, a plastic sheet, you need to bring something, even to tie the cord. But all that is contained in this kit. So this is a lifesaver, even for the healthcare service provider or the midwife. So we really appreciate, and I would really like to extend our sincere appreciation to some of our donors. I'm singling out why UK government, because they've been really supportive to us here in Zambia in terms of maternal health care services. Thank you.
Fantastic, thank you. And I'm just going to quickly touch on some of the questions in the Q&A. Someone has asked a very good question of, can you explain what a dignity kit is? So what's the difference between a birth kit and a dignity kit gift?
Okay, a birth care or a delivery, it's like a mini delivery set.
Yes.
Which contains tools for delivery, but simple tools like even a Macintosh, a plastic sheet, a thread to tie the cord, a clean razor blade. A dignity kit that I was referring to during the COVID-19 pandemic, you would find that because of restrictive movements, some women would not even go to buy sanitary wear. And we have a piece of cloth that we wrap around, which is called a chitenje. So if you can't access, the shops to buy your sanitary wear, or even if you can, maybe you don't even have the money, especially during the COVID-19 pandemic, when they could not even sell their items, they were now locked up in the houses. We ensured that we restored the women's dignity, because this dignity kit has sanitary pads, as the chitenje, is a piece of soap. It also has a toothbrush and toothpaste.
Amazing.
So that is, so we gave those to most of our vulnerable women and girls.
Fantastic. I mean, the answer is we want plentiful supplies of both. They're both incredibly important, and as we know, UNFPA is about providing dignity and respect and reproductive rights to women at all different stages in their lives. So all of those supplies are really important. I'm afraid, panel, that we've run out of time. It has been so fascinating talking to you. And Gift, I would love to hear more about the work in Zambia. And Austin, I'd love to ask you lots more questions about Grace and her family and your experience there. But I hope our audience feel it's been a rich and interesting time, and that they're going to be leaving more informed about this incredible work. So I'd like to thank both of you a huge amount for both, being here today, but more importantly for dedicating your life to both delivering this vital work, and Austin for helping to tell the story about this really important work. And thank you to everyone who's joined us as well. It's been such a pleasure for me to gain a deeper understanding of the challenges that women like Grace face around the world, and be re-inspired. I was already inspired, but be even more inspired by the direct impact that organisations like UNFPA can achieve with relatively simple resources. They can save lives. They can make sure that women get to live the lives that they deserve. So I'm so inspired by our community, our Friends of UNFPA community, that believes with us that, as you've said, Gift, the life of every single woman, girl, and baby matters, as every single loss is a tragedy. So going into the end of this financial year, we are focusing our efforts at Friends of UNFPA on safe motherhood. And one way that anyone watching who's thinking, how can I help, that you can support this work, is you can support by helping to fund an emergency birth kit, which, as we've already heard, it includes items like a plastic tarp, gloves, and a razor blade. Very simple items, but ones that can save a life. They help women to give safely birth in the middle of a crisis. We aspire for women to be able to reach clinics, but for example, in the earthquake that recently took place in Haiti, or the collapse of the healthcare system and aspects of it in Afghanistan, we can't always manage the conditions that enable somebody to reach a clinic, but we can try and make sure that they give birth safely. So please, if you want to help, please go to the Friends of UNFPA website. One kit is just $5, but that $5 could, in theory, be saving the life of a woman and her baby. So we hope that with Grace's story has given you a sense of joy and hope today. I certainly was hugely inspired by Grace, particularly her humor and resilience, and she feels like someone who's living her best life. So by providing women with access to midwives and simple tools, we can all work together to make sure that more women like Grace receive the services that they deserve. And so on that note, I think thank you all again. Thank you, Gift. Thank you, Austin. And thank you to everybody who joined us.
Thanks so much, everyone.
Bye-bye. Bye, everybody. Take care.
Bye.
Thank you.
Thank you, Gift.
Thank you, Austin. Take care.
You too.